We've been hearing a lot about BrainSense technology in deep brain stimulation. So what exactly is this? Imagine we have a water tank and a tap that fills this tank. Now let's say there is a leak in this tank and the amount of water that escapes from the tank varies at different points in the day. Now let's say our target is to keep the water at a particular level within this tank. Now there's one way that we can ensure that the water is always present in the tank, and that is by leaving the tap open at a fixed rate. Now when we keep the tap open at a particular rate, the level of water within the tank can also vary depending upon the leak. So at times in the day, the level might be as much as we need. Sometimes it can be more, sometimes it can be less. To achieve the target of keeping the water at a particular level, what we can do is keep a monitor which tells us what the water level is at different points of time in the day. Now, when we have this information, it is easier to decide the rate at which we should leave the water tap open so that the level can be as much as we need throughout the day. Similarly, in case of Parkinson's disease, the amount of abnormal activity within the motor circuit of a Parkinson's disease patient varies across the day. So initially what we used to do is when we placed a DBS electrode, we would fix the current parameters to a particular rate and the rate would remain the same throughout the day. Now because there was variation in the abnormal activity, there were times in the day when the patient was absolutely normal and there were times when there was understimulation and times when the patient was overstimulated. Now with BrainSense, what we have is information about the extent to which the abnormal activity is present. Now, because we have this information, it is much easier for us to decide how to program the patient so that they can remain as normal as possible for most of the day.